All right, today we're going to play medical detective. We're diving into a really common condition that causes a very specific kind of pain, peptic ulcer disease. So let's get right into our first clue.
You know that feeling, right? That deep, burning ache right in the pit of your stomach? So many people have felt it. But what is actually going on inside your body to cause that? Well, that's the central mystery we're cracking today.
So, where do we even begin this investigation? We start with the number one clue, the thing that sends most people looking for answers in the first place.
Now, this isn't just any old stomach ache. We're talking about a persistent, nagging, burning pain right up in the upper part of your abdomen. It's your body's own alarm system, basically screaming that something is wrong with its protective lining.
Okay, so clue number one is on the board. Now, what exactly is this thing we're hunting for? Let's get a clear-cut definition of the peptic ulcer itself.
So, at its heart, peptic ulcer disease, or PUD for short, is pretty much a break in the wall. It's a chronic sore, a breach in that delicate lining that's supposed to protect your stomach and the very first part of your small intestine, the duodenum, from all that powerful acid.
And wow, take a look at this. This shows you exactly what we're talking about. You can literally see how the ulcer looks like a punched-out defect. It's a clean, sharp hole in that protective layer. This right here, this is our scene of the crime.
All right, so if that's the crime scene, who are the criminals? What's actually causing this damage? Well, our investigation points to three major culprits that are almost always involved.
Let's line up the usual suspects, shall we? First up, we have this incredibly common bacteria called Helicobacter pylori, or H. pylori. Second, the regular use of NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen. And rounding out the trio, cigarette smoking. Each one of these is a master at weakening the stomach's defenses, and believe me, they're responsible for the vast majority of cases.
And here's where it gets really nasty. These culprits don't just work alone, they team up. Smoking, for example, has what we call a synergistic effect with an H. pylori infection. That means when they're combined, the damage isn't just 1 + 1. Oh no, it's multiplied. It's a real tag team of destruction.
So we know who did it, but how do they pull it off? How do these things actually manage to break through the stomach's incredibly powerful defenses?
I want you to picture your stomach lining like the wall of a fortress. On one side, you've got all your defenses, a thick, slimy mucus layer, chemicals like bicarbonate to neutralize acid, and good blood flow to quickly repair any damage. But on the other side, you've got the attackers, that powerful stomach acid, H. pylori bacteria, and drugs like NSAIDs. An ulcer? That's what happens when the attackers overpower the defenses and bust a hole right through the wall.
Once you understand that battle, it makes it a lot easier to interpret the symptoms. So let's take a closer look at the specific warning signs the body sends out.
See, the pain isn't just random. It follows a very specific script. It usually flares up a couple of hours after you eat, once the food buffer is gone but your stomach is still pumping out acid. It also loves to get worse late at night, often waking people up. But here's the weird part. Eating again or taking an antacid can actually relieve it for a little while by neutralizing that acid. And it's not just about the pain. Our investigation can uncover other clues too. Things like nausea and bloating are pretty common. But you can also see more serious signs pop up, like iron deficiency anemia from a slow, undetected bleed, or even significant weight loss.
Okay, now this next part is absolutely crucial. Not all ulcers are created equal, and their shape tells a really important story. A typical benign ulcer has that clean, sharply punched out look we saw earlier, with flat edges. A cancerous ulcer, on the other hand, often has these irregular, heaped-up margins. Being able to tell that difference is one of the most critical parts of the diagnosis.
So that brings us to the worst-case scenario, the most serious potential outcome of an untreated ulcer. What happens when the damage just keeps going deeper and deeper?
The most dangerous complication is called perforation, and it is exactly what it sounds like. The ulcer literally creates a hole that goes all the way through the wall of the stomach or duodenum, spilling digestive contents right into your abdominal cavity. Yeah, it's as bad as it sounds.
And if you zoom way in with a microscope, you can see just how deep this damage goes. The base of the ulcer is a total battleground of inflamed tissue and scar tissue. It's your body desperately trying to patch up a deep, persistent injury. A perforation is what happens when that battle is lost, and the entire wall just gives way.
And I really can't overstate the severity of this. A perforation into the peritoneal cavity, that's the space surrounding all your abdominal organs, is a massive surgical emergency.
It requires immediate, life-saving intervention, which is exactly why understanding and treating peptic ulcer disease is so critical.
So when you boil it all down, it comes back to that balance of power. The stomach's fortress is remarkably strong, designed to handle some incredibly powerful stuff. But as we've just seen, it is not invincible. So the final question to think about is what in our lives might be weakening those walls?